Men, are you over 40 trying to lose weight, but nothing seems to work? So now you're considering weight loss surgery or maybe even a GLP-1? You're not alone, and this is not an issue of poor willpower or motivation. Many men who had been fit or were able to maintain or lose weight easily in their 20s and 30s sometimes feel like they hit a wall when the big 40 shows up on their doorstep. But before you start on tirzepatide or consider weight loss surgery, there are a few things you really need to check first. There are several factors that may be working against you, and you may not even realize it. So today, as a physician assistant with 20 years of experience working with bariatric patients, I'm going to walk you through 6 things that can make a huge difference before you choose a weight loss path. I'm also going to give you an additional idea to help you track your health journey the right way, regardless of what weight loss choice you make. First, hormone shifting. As men get older, testosterone levels decline. And when this hormone declines, your energy, sleep, and metabolism are all affected. Especially for men, a decrease in testosterone can really increase the amount of belly fat you carry around, which unfortunately is a strong indicator for heart disease, diabetes, and other problems. So this is something you want to have checked with your healthcare provider and understand your testosterone replacement options before choosing a weight loss option. Second, sleep. If you're waking up exhausted, even after a full night of sleep, you may be dealing with something called sleep apnea. And this is a very common issue in people who struggle with their weight. Untreated sleep issues not only make weight loss much harder, but also increase the risk of other health problems. Most insurance plans do cover sleep apnea testing, so ask your healthcare provider if a sleep center referral is a good option for you. Third, your nutrition. Not guessing, but actually working with a registered dietitian, even for a short period of time, because being honest about your dietary habits and making even small daily changes over time in not only your health, but your energy levels and mood. So ask our healthcare provider for a referral or recommendation if you would like to work on improving your diet. And hey, most people don't know this, but dietitian visits can be performed using a telehealth platform, meaning you can meet at your convenience from wherever you are. Fourth, your habits. Whether you choose surgery, an endoscopic procedure, or weight loss medications, optimizing your health becomes center stage. And unhealthy habits will need to be decreased or eliminated if at all possible. So it's best to start now. You'll be happy you did in the long run. And there are medications that can help you modify your alcohol and smoking habits. Just ask your PCP for details. Fifth, metabolism. Men usually begin losing muscle mass in their 30s, and this continues as you age. How to combat this? Not extreme workouts, just consistent movement that rebuilds your muscle mass. So start small and build. Sixth, your emotional health. Men in chronic high-stress environments can have chronically elevated cortisol levels. This shifts your body into chronic survival mode, which unfortunately encourages the body to store fat while increasing cravings for comfort and high-carb foods. It's a recipe for disaster, and food becomes a very easy way to escape or provide comfort. And if food is tied to stress like this, no medication or surgery alone will fix it. So maybe it's time to reach out, do something for you, and get a new perspective through the eyes of a mental health professional. You don't have to just push through anymore. You can get confidential help in a safe environment. This allows you to negotiate this time of your life in a positive way without destroying your health. Learning to care for yourself with healthy coping strategies is no doubt one of the most important keys to unlock successful weight loss long term. And here's the bonus. And this is something most people don't even think about. But over the years, I've seen many patients regret not doing it sooner in their weight loss journey. And that is getting a DEXA scan with body composition. This gives you a much more concise picture of your health beyond just your weight, BMI, or lab work. Measuring this about every 4 to 6 months gives you valuable insight about whether or not you're going in the right direction with your weight loss efforts, so you can make healthy adjustments if needed. And a quick side note on this, most people think this test is expensive and time consuming. And I can tell you, at least here in Texas, the test is only $60. The appointment can be made easily online, and you can be in and out from getting your test in 10 minutes. Results can be mailed to you within 1 to 2 hours. So if you're interested, I'm going to link the name of the company below that I use. They have locations all over the country if you want to check it out. So keep in mind, once you hit midlife, weight loss isn't just about eating healthier. It's about understanding your body's changes and what you can do to maximize your health, energy, as well as your mental well-being. And since today is Father's Day, I want to wish all of you dads out there a happy Father's Day. If you're trying to figure out what weight loss option actually makes sense for you. That's exactly what I help people think through on this channel. So be sure to subscribe. I release 3 videos a week that explain the professional weight loss world. I hope these videos help you feel informed and confident when you discuss weight loss options with your healthcare provider. I'm Grace, and this is Weigh In Wellness, where I provide safe, thoughtful, and fact-based information on surgical, endoscopic, and medical weight loss. This information is educational. I'm a physician assistant, but I'm not your PA. Decisions about treatment should always be made with your healthcare team. Thanks for watching, and I'll see you in the next video.